we got really muddled up during this pandemic with mandates and what the government was telling people they had to do. And now all of a sudden, because of what the government was saying, certain employers started forcing things upon people. And I've had a number of conversations with great people in the medical profession and people who have actually chose to walk away from the medical profession rather than have the vaccine or get the vaccine, because they've, for whatever reason, the data that they looked at made them choose not to do it. And we've had good people lose, especially and we're talking about healthcare. So we've had many good people in the healthcare profession either fired or walked away from the profession because they refused to take the vaccine. We've also had people in our military. Our military was mandated by President Biden to get the vaccine, and many soldiers, sailors, airmen, and guard members and things have now lost their jobs, not lost their jobs, but actually kicked out of the military because they refused the vaccine. Now, I would contend that when you're losing your frontline workers in the healthcare profession and you're losing your frontline military members, we are not making our country safer. We are not making our country healthier. And that's, again, this is just my opinion, layman in middle America, but I'm making this decision. I was in the military, and the military should be nothing more than a force for protecting our country and protecting our citizens. And it does nothing to make us safer by mandating that people who are all rights in the best shape of almost anybody in the country. So give me your thoughts on that, Francis, if you would.
Well, I'll talk about healthcare because that's more what I know about. As the NIH director for those 12 years, I also oversaw the world's largest research hospital on the campus in Bethesda, Maryland. People who come to that research hospital are people who've basically run out of options for standard medicine. Many of them have cancer. They may have an immune disease. Many of them are children. They are really sick and they're really vulnerable. And a passing virus, even something not as bad as SARS-CoV-2, could basically spell the end of their opportunity to stay alive. So we had the same issue. I have 46,000 people that worked for me at NIH, and some 4,000 of them were in this hospital where they could have direct patient interaction. And this was at a point where we basically had to decide, was it okay for somebody who was unvaccinated and therefore could very well be carrying this virus readily and passing it on to be working with patients. And I just couldn't see that that was legitimate or justifiable. So we required it for healthcare providers in order to protect those vulnerable kids and adults who were probably about the most likely to die of anybody you could think of if they got COVID. And I felt that was the right thing to do. And there were a few people who refused and had to be reassigned to other places where they didn't have patient care. It just didn't seem ethical to allow that kind of risk to happen. And I think that's the dilemma that a lot of hospital executive directors were faced with. Could they actually justify putting patients at risk? They come to hospitals in vulnerable places and hospitals promise to take care of them. And then what? They're going to get infected by somebody who's carrying the virus who didn't get vaccinated. It just didn't seem right. So I will defend that. The military, I know less about.